Hi, today I'm going to talk about cholecystitis. So cholecystitis is a disease of the gallbladder, which is an organ that's located under the liver. It's a small pear-shaped organ and it stores and releases bile. Cholecystitis is an inflammation of the gallbladder and it can be acute or chronic. Gallstones are made up of cholesterol or bile pigment and they can obstruct the flow of bile in the cystic or common bile ducts. So gallstones cause acute cholecystitis, and this is associated with right upper flank pain, fever, and leukocytosis. Chronic cholecystitis is thought to be related to a chronic inflammatory cell infiltration of the gallbladder, which is caused by mechanical irritation or recurrent attacks of acute cholecystitis. The pathophysiology involved includes inflammation that occurs most commonly from gallstones within the gallbladder, and this inflammation releases inflammatory mediators that then worsens the inflammation. Acute cholecystitis occurs due to the obstruction of the cystic duct, and again, that's from gallstones. The gallstones obstruct the flow of bile, and patients will suffer from biliary colic, which is a term that's used to describe the pain that's felt from the gallbladder muscle severely spasming as it attempts to move the stones along in the digestion. Acalculous cholecystitis does not involve gallstones. It's less common. It happens in about 10% of patients that have cholecystitis, but it does have higher morbidity and mortality rates. It's seen in patients that are already hospitalized or critically ill most often, and it's caused by gallbladder stasis and ischemia. So basically a dysfunction of the gallbladder. The gallbladder ischemia and stasis, as well as endothelial injury, can cause a concentration of bile salts, which then causes gallbladder distension and can eventually cause necrosis of the gallbladder tissue. The most common complication of cholecystitis is gangrenous cholecystitis, and that can happen in up to 20% of cases, and it is considered life-threatening. These patients will present with typical symptoms, so the abdominal pain, fever, leukocytosis, but then also have signs and symptoms of sepsis because of the inflammation response that is becoming more systemic. So they might be hypotensive, tachycardic, have elevated lactic acid levels. Risk factors involved with cholecystitis. It does happen more often in women than men, or I should say gallstones develop more often in women than men. Other factors that put people at higher risk to develop gallstones include obesity and high cholesterol diets. Women who have given birth to multiple children are also at higher risk to develop gallstones. And then risk to develop the acalculous cholecystitis, so that's the type that doesn't involve gallstones, are, like I mentioned, the patients that are already severely ill, hospitalized with infections, complications from diabetes, patients with AIDS, or immunosuppressed patients. Major signs and symptoms, as I've mentioned, is the right upper quadrant abdominal pain, fevers, leukocytosis, which is due to the inflammation of the gallbladder. The abdominal pain is at the right upper quadrant where the organ is located, and it can radiate into the shoulder and back. Patients can also complain of nausea and vomiting and anorexia due to the buildup of bile in the gallbladder and the inability for the bile to be released. So here's a picture of the organ, the gallbladder itself, which is, like I said, situated right underneath the liver, and these little stones that block the flow of bile. An ultrasound will show that the patient's gallbladder wall is thickened due to the inflammation, and they may also have a positive sonographic Murphy sign, which is pain upon the palpation with the ultrasound transducer. So when the patient's actually having the procedure performed, the palpation of the ultrasound transducer causes pain for the patient. An ultrasound can also identify gallstones within the gallbladder. The most common treatment for this disease is surgical. Patients will have a laparoscopic cholecystectomy. If patients are at high risk or not surgical candidates, they can receive IV antibiotics, or gallbladder drainage procedures can be performed. So that's my discussion on cholecystitis. I hope you learned something new today. Thanks.